Hi, this is Pam from Your Nurse Advocate Consulting, and we are here for another Tuesday Tips. Tonight's topic is, again, we've been talking about end-of-life cares. It's a very sensitive, very delicate topic. We're going to talk a little bit this evening about managing symptoms at home and what recommendations, what we can share with you. And not everyone is ready to accept hospice, and we've talked about the differences between palliative care and hospice. And palliative care, we're going to spend just a couple of minutes on palliative care this evening, talking about the different services they have and how they can help control symptoms and what to look for in a palliative care service that might be good for you. Also, we're going to talk a little bit about end-of-life doulas. That is another option that you can have alongside hospice or instead of hospice. So there's a lot of services, a lot of things out there, resources for you to help you manage your aging loved one, especially if they want to spend out their last days at home. So again, welcome to Tuesday Tips. I know we're getting ready to go into the holiday season. November, we're going to kind of wrap things up with end-of-life cares. I know this has been, not everybody's favorite subject, but it's something that we still need to talk about because people need to know the information. People need help. And oftentimes when you're right in the middle of the weeds, that's not the best time to receive the information because everything is in influx, emotions are high, and you're maybe not in the best space to process the information. So we always like to offer this information as well. So let's go ahead and jump in. So when we're talking about palliative care, there's a couple of types of palliative care. And what I mean is the services are the same, but palliative care is paid for by Medicare. It is paid, though, under the Part B benefit, which means if you have co-pays, it's like going to the doctor's office. So if you have a Medicare Advantage plan or a supplement plan, if you pay a copay going to the doctor's office, then most likely you're going to have a copay for palliative care. Now, palliative care can be offered in a couple of different scenarios. If you have an aging loved one that is maybe debilitated from a chronic illness, maybe some chronic condition or cancer, then maybe it might be very difficult for them to be able to get out of the house to go to the doctor's office. Well, palliative care can be an answer for that because some palliative cares, not all of them, but it's real important to ask if you think palliative care may be of benefit. Ask if the palliative care provider comes into the home. If they come into the home, that's going to help you not have to take your loved one to the doctor anymore because now you will have a provider that come to the home, can check on their symptoms, make sure they're managed. They could converse with the primary care doctor, make sure the medications are correct, or if there's any changes that need to be made. Otherwise, a palliative care is like going to the clinic, going to the doctor's office, but you're seeing the palliative care physician at their office. So two different ways palliative care can provide you those services, but their job is to manage symptoms. Their job is to help you live the best life you can while managing a chronic illness. And the nice thing about having palliative care services is they are oftentimes palliative care and hospice are in the same company. Sometimes they're not, but palliative care, they're really good at knowing when might be the right time to transition to hospice is. So it's nice to have palliative care in as soon as possible because they will do a great job of managing symptoms, even before the time has come when maybe considering hospice is a possibility. So it's real important if you're considering palliative care to manage a chronic illness and manage the whether it's pain, whether it's swelling, whether it's shortness of breath. These are all the kind of things, the symptoms that palliative care can address. And so just if you're looking at that and you're asking your doctor if they would think that palliative care would be appropriate and they would order that, then just find out if you need palliative care in the home or if you are prepared to be able to take your loved one into the palliative care provider's office for a doctor's appointment. So, choosing between the two depends again on, we talked about the condition, the preferences, in home or going to the doctor's office. So let's, let's talk about pain management. That's one of the symptoms that can be addressed by hospice, can be addressed by palliative care. Opioids and also non-opioid medications are vital. Um, it depends on a lot of people have concerns about the opioids. There's a lot of other non-opioid pain medications that they can try. I mean, there's lidocaine patches. There's different kinds of things. There's holistic approaches. There's massage. There's acupuncture. There's guided relaxation techniques. And there's also things like CBD oil. There's cannabis providers. If you're in a state where cannabis is for medical use is legal, there are practitioners out there that actually can work with the dispensaries and determine, based on your condition or your symptoms that you're trying to work on, is they can put together the right cocktail that they think would be most appropriate for you. If cannabis or medical marijuana is not legal in your state, which here in Wisconsin, where I live, it is not legal, then there are some you can still use the CBD oil, which is now available over the counter. It does not have any THC in it or any mind altering chemicals in there. I mean, there is the Delta 8 and but it's best to work with a provider or a practitioner that is, a holistic provider, that is what they deal with. They use that as an alternative. I was very much a skeptic, when it came to using CBD oil, until I had a hospice patient who suffered from severe seizures. He had a brain tumor. His condition was terminal, and he was on hospice, and he could not. He went into the emergency room, and he was in the emergency room for 8 hours trying to get his seizures controlled. And the family, he was young, he was in his 50s. His youngest daughter was only 12 years old, and the wife was desperately looking for something that could control the seizures, that wouldn't make him so drowsy or so sleepy that he couldn't interact with his children and spend quality time with them. And so, we could not, our providers were not in a position to recommend that, but she found, a holistic provider that would be able to give her recommendations on the CBD oil. And again, it was with no THC. It was not a Delta 8. It was just a CBD oil with no mind altering chemicals. But the CBD oil worked wonders for him. He never had any more seizures, never ended up back in the emergency room, and he was much more alert and awake, and had a much better quality time left with his children and his wife than he had prior. And so I'm not saying that this works well for everyone. I'm not a provider. I'm a nurse advocate, so we can educate, but we don't provide medical advice. So all of these tools that we share with you is for educational purposes only. So please reach out to a provider. We can, as part of being an advocate, if that's something you're interested in trying to find, a holistic provider that may be able to give you some recommendations on that, we certainly can help you find one and vet one and make sure that they are a quality provider. But these are just, we wanted to give you some extra things to, to think about if you're one that would like to think outside the box as far as, other treatments to help with symptoms. One of the other symptoms that can be addressed with palliative care or hospice, as we're dealing with this chronic condition, is, addressing fatigue, whether it's a poor appetite. Now, we have to stress the differences. Now, in that final journey, in those last, couple of weeks of life, and it's not an exact science. Again, it's like I when I've talked to our clients that are diabetics, unfortunately, it's not a cookie cutter approach where one recipe, if everyone follows the same recipe, everybody's going to get the same results. That's not how it works. And end of life care, going through those final stages of end of life, is very different for everyone too. Everyone goes through the stages, and we've learned those very well as hospice nurses, but not everyone goes through them at the same time or spends the same amount of time in the stages. But what I want to say is we don't want to confuse loss of appetite versus loss of appetite during those final stages, because when your body is going through the natural process of preparing itself to pass, it's very natural for the body to go through a short period of extreme thirst, but then the thirst goes away and the body starts to naturally dehydrate itself, and it's not, you're not hungry, you're all the muscles and everything start to deteriorate and weaken, so the swallowing muscles start to weaken, and so the body doesn't want food. And it's hard because we all know if you're not eating or drinking, we know the result of that. So it's very family, it always wants to make sure that their loved ones eating and drinking, but if they are in that last phase of preparing the body itself, preparing it to pass, then you could cause a loved one to choke on fluids as well as food. So the body knows what it needs to do to be prepared. So, but we don't want to confuse that with just maybe an illness, maybe with chemotherapy. We don't want to confuse that with maybe just having some other reason causing a poor appetite. There are things that they can give you to help increase that appetite as well. Now, there's emotional support. We talked about medications to help with swelling, about medications that can help with breathing. And here, I like to give my 2 cents in on the morphine. A lot of people say, during hospice, people give, the liquid morphine, depresses the respiratory system, and you just do it to make them pass sooner. And, one thing about morphine is morphine has a very short half-life, which means it leaves your system, relatively quickly. And one of the properties of morphine is it relaxes the smooth muscles of your body. And when I say smooth muscles are the muscles that are involuntary, your heart beating, your lungs breathing, things that we can't control. And so by relaxing those muscles, it makes it easier to breathe. So yes, we're not going to start giving, people all kinds of morphine for no reason. But, I had a hospice patient with a chronic obstructive lung disease that, over a year being on hospice, we gradually increased her morphine, her pills, as well as the drops, for rescue for acute shortness of breath. And she was able to, I think, live out and really extend the quality of her life, with close observation. This is something that needs to be, watched by your provider, by healthcare professionals. But I just wanted to say, I didn't want everyone to be totally afraid of that, because there are, used in the appropriate amounts and for reasons, it can be very helpful. And there's also emotional support. There's whether or not someone may need antidepressants or anti-anxiety medications. And of course, the holistic measures, whether it's music therapy, seen some wonderful things with music therapies. There are certified music therapists out there. I've seen some great things with Alzheimer's patients that have been nonverbal, and the music therapist does their assessment, learns the music that they liked, what was important to them, and I've seen them singing when they have not spoken a word in a very long time. So a lot of these therapies, these holistic approaches can be very powerful. Meditation, mindfulness, like we talked about, acupuncture and massage, and those things can be very, very, very helpful. We talked about alternative therapies. We talked about a cannabis nurse or provider that specializes, with the symptoms controlling, like pain, nausea. Nausea is another big one. Nausea can be very troublesome depending on the illness you have or the type of cancer. And sometimes some of these medications can help with the nausea as well, because that can be very troublesome. And again, if you're constantly nauseated, who's going to feel like eating when you have, you just have an upset stomach all the time? So always check with your doctor before starting a new therapy. you know, um, my mother-in-law, another great example of my mother-in-law, she used CBD oil. Actually, uh, we got some, again, the CBD oil or medical marijuana is not legal in Wisconsin here, but the CBD oil is not marijuana. So that's, again, available over the counter. But we did get some recommendations from a provider who was willing to share, what the dosage and it should be and how much to use. And we were very grateful for that. She had inoperable cysts on her spine, and it was pressing on her nerves, shooting pain down her bottom all the way down her leg. She could barely walk or get up out of the chair, and it did amazing results for her over a period of time. She was able to get back to her normal activities, and we did, she was very fearful. I mean, she was miserable living her life in all that pain. So another great example. But again, please don't try any of these um, treatments without getting the help from a medical or a health professional. So please don't self-medicate. So we want you to find a reliable healthcare provider that's experienced in recommending these alternative therapies. And so please, again, we just ask you to seek professional guidance. So getting back to palliative care, I mean, it's crucial for managing symptoms, at home. They offer really such a comprehensive support rather, and just make sure that they're going to coordinate care. They're going to get you the equipment or supplies that you may need. And again, hospice is very different. Hospice, under the hospice benefit that comes under Medicare Part A, you never pay anything. There's no copays for hospice. You get hospital equipment such as a hospital bed. You get all your medications that are used to treat your terminal illness. All of that is covered under the hospice benefit. So there are a lot of services that you can gain by using hospice. And we always tell people, hospice is something that you should consider sooner rather than later, because at the last minute, at those final days when you feel, okay, now we're finally ready for hospice, hospice can do so much more if they have more time. And which leads me to another point. So, another professional that would be very useful in end-of-life cares would be, an end-of-life doula. Now, an end-of-life doula has special training, but they're not necessarily a nurse or a healthcare provider. But they can come along and help you with making the, end-of-life cares and end-of-life process as peaceful and as meaningful as possible. They can help with things. They can work with hospice or work independent of hospice. They can help putting together, photo albums or legacy journals, or there's all kinds of things that they can help you do to preserve the memory of your loved one that maybe you don't have time to do. And so we do, if you're on our YouTube channel, Your Nurse Advocate Consulting, we have, videos on end of life. We have Crystal Flores is a friend of ours, a friend of Your Nurse Advocate, and she's an end-of-life doula, and she's done many talks with us and explaining how those services work. She also trains end-of-life doulas, so that would be a great resource. I'll put that link to that video in the notes of this one here for the Tuesday tip. So with that being said, look at all your options. Check out your resources to help you with end-of-life cares. There's a lot of different things out there. Please, if you have any questions, just reach out. We'd be very happy to send you in the right direction or get your questions answered, or share resources that we're aware of. So with that being said, we are going to go ahead and end this Tuesday tips, and we'll see you back here next time. Take care.